And Glenda, Nave, no surprise, this continues to be a very divisive issue. Democrats say this bill will help millions of uninsured Americans. Republicans believe it spells trouble for the country. The battle over how you get your health care moves from the House to the Senate. After a marathon session Saturday, the House narrowly passed overhaul legislation that includes a public option.
It's my judgment that the Senate will pass a bill much like what the House passed.
Congressman John Dingell at the airport late this afternoon after returning from Washington. The man known as the Dean of the House, the man whose father first introduced universal health care decades ago, expects the Senate to now pass a bill similar to the one in the House.
I'm satisfied with this because, as I mentioned, the nurses, the AMA, the AARP, and all kinds of business and citizens groups, trade unions support the legislation.
Getting health care legislation through the Senate will prove a much tougher challenge, especially with a bill that includes a public option. Still, Senator Debbie Stabenow is optimistic.
The bottom line is we want to stop the unfair insurance practices. We want to strengthen Medicare and lower costs for small businesses and people that can't find affordable insurance today.
Besides a public option, the bill passed by the House Saturday would extend coverage to tens of millions of uninsured Americans. It would force large companies to offer insurance to employees and ban insurance companies from withholding coverage because of pre-existing conditions. Republicans say it's just too good to be true and that this legislation will drown the country in bureaucracy and slam citizens with higher taxes.
It's going to raise costs for people. It's going to lower quality. It's going to reduce choices. It's going to cost jobs. It's $1.3 trillion, and it's going to rely on taxes, new mandates on people. And what's odd, especially for us in Michigan, when we've seen the necessary restructuring of the auto industry to get leaner, more efficient, more accountable, it's odd that the federal government doesn't feel compelled to do the same.
And Republicans are also saying many people who have health insurance through their employer will be forced into a government plan because it will be too costly for companies to provide insurance. We'll be following all the developments. Dave, back to you.
Tom, thank you.